Hello everyone. Today we are going to discuss some of the MCQs in immunization. There are two parts of this video. This is the part 1. It has 4 sections. Every section contains 10 MCQs. Section 1 General Principles and Practices. Section 2 Childhood Immunization. Section 3 Adult and Special Population Immunization. And Section D Vaccine Specific Questions. Question number 1. Which of the following is a recommendation for vaccine providers? We have 4 choices A, B, C, and D. Choice A, immunization by appointment only. B, administer vaccines only if written physician orders are there. C, use every clinical encounter to review and administer needed vaccines. And D, delay immunization until after an illness resolves. Correct answer is C. Question number 2. How long the immunization record is kept? A, only paper records are acceptable. B, vaccine providers should maintain easily retrievable summaries of immunization records. C, records can be destroyed after 1 year if no vaccine was given. And D, vaccine recipients should keep their own record, but the provider need not document. Correct answer is B. Question number 3. It is recommended that an interrupted vaccine series should A, be restarted from the beginning. B, be ignored because the protection is lost. C, be discontinued. And D, be resumed and completed according to age appropriate schedule. Correct answer is D. Question number 4. Which injection site is preferred for an intramuscular vaccine in a 10-month-old infant? A, gluteal muscle. B, deltoid muscle. C, vastus lateralis, that's the anterolateral of thigh. And D, subcutaneous tissue over triceps. Correct answer is C. Question number 5. Which of the following is not recommended for children? A, measles. B, tetanus. C, human papillomavirus at infancy. And D, varicella. C, human papillomavirus at infancy is the correct answer. Question number 6. Adults 18 years or older not previously immunized, what is the recommended interval for tetanus diphtheria booster? A, every 5 years. B, every 10 years. C, once in a lifetime. And D, only if injured. Correct answer is B. Question number 7. Which adult age group is recommended to receive a single dose of RSV vaccine? A, every adult 18 years or older. B, adult 50 to 59 years regardless of risk. C, adults 75 years and older. And D, only adults in chronic care facilities. Correct answer is C. Question number 8. Which of these is required when some vaccines adverse events following immunization occurs? A, only document in the health record, no external reporting needed. B, providers should report clinically significant adverse events promptly and completely. C, reporting is optional unless death occurs. And D, reports go only to the manufacturer. Correct answer is B. Question number 9. Children less than 9 years of age receiving influenza vaccine for the first time, the schedule is A, 1 dose anytime. B, 2 doses at least 4 weeks apart. C, 2 doses at least 8 weeks apart. And D, 1 dose only in the flu season. Correct answer is B. Question number 10. It is true or false. The gluteal muscle is the preferred injection site for IM vaccines in infants and very young children. A. True and B. False. Correct answer is B. It is false. The preferred injection site for IM vaccines in infant is anterolateral of thigh, that is the vastus lateralis muscle. Question number 11. The first dose of MMR vaccine should be given at A. Birth, B. 6 months of age, C. 12 to 15 months, and D. 24 months. Correct answer is C. Question number 12. The second dose of varicella vaccine for a child should be administered A. At birth, B. At 4 weeks after first dose, C. At 18 months or before school entry, and D. At 5 years only. Correct answer is C. Question number 13. Which of the following vaccines is typically given at 2 months of age? A. Human papillomavirus vaccine, B. Diphtheria, tetanus, pertussis, polio, and Hib, C. Shingles, and D. Pneumococcal conjugate in an older child only. Correct answer is B. Question number 14. In children who have not been previously immunized, the hepatitis B schedule is A. 2 doses at 0 and 6 months of age for all children, B. 1 dose only at birth, C. 3 doses at the ages of 0, 1 and 6 months, and 4 doses as standard. Correct answer is C. Question number 15. For children aged 7 to 17 years, which of these statements is true for HPV vaccine? A. 2 doses may be considered for 9 to 17 years at least 24 weeks apart. B. Only 1 dose is ever recommended. C. 3 doses always required. And D. HPV is not recommended in this age group. Correct answer is A. Question number 16. A child under 5 years with no prior pneumococcal immunization and no risk factor should receive A. No vaccine needed, B. Only influenza vaccine annually, C. 3 doses starting at birth, and D. 1 dose of pneumococcal conjugate 15 valent or 20 valent at 24 to 60 months of age. Correct answer is D. Question number 17. Which vaccine is routinely given around 12 years of age regardless of their early vaccination? A. Meningococcal conjugate, B. Smallpox, C. Rabies, and D. Typhoid. Correct answer is A. Question number 18. For children from birth to 7 years old who were never immunized, the doses should be spaced at least A. 1 week, B. 4 weeks in many cases, C. 2 months always, and D. 6 months always. Correct answer is B. Question number 19. When giving multiple injections at a visit, the vaccine provider should A. Always wait 30 minutes between injections, B. Administer injections in the same limb, C. Use recommended site and needle length for each age group, and D. Avoid giving any vaccines if the client has a cold. Correct answer is C. Question number 20. Which of the following statements regarding the first influenza vaccine dose for children 6 months to less than 9 years is correct? A. They need only 1 dose ever. B. They require 2 doses if it's their first time being vaccinated. C. They cannot receive the vaccine. And D. 2 doses are only needed for children older than 9 years of age. Correct answer is B. Question number 21. An adult aged 21 to 26 years who has not yet received human papillomavirus vaccine should receive A. No vaccine needed at this time. B. One dose only. C. Two doses of HPV-9 and D. Three doses of HPV-9 automatically. Correct answer is C. Question number 22. In the adult immunization schedule, which of the following vaccines is recommended annually for all adults without contraindications? A. MMR, B. meningococcal B, C. varicella, and D. influenza. Correct answer is D. Question number 23. Which vaccine is specifically recommended for adults at high risk due to chronic conditions or age? A. Shingles only, B. RSV vaccine for older adults, C. rotavirus vaccine, and D. measles booster every 5 years. Correct answer is B. Question number 24. Of a 5 years old adult with no prior tetanus diphtheria immunization should A. never receive it, B. receive a single dose only, C. begin a primary series and then booster every 10 years, and D. receive it only if a wound occurs. Correct answer is C. Question number 25. For adults previously immunized, the recommended Tdap booster A. every 1 year, B. only once in a lifetime, C. no need for any boosters, and D. at least once as an adult if not already received. Correct answer is D. Question number 26. Adults born in or after 1970 who are non-immune to measles and mumps should receive A. one dose of MMR, B. two doses MMR at least 4 weeks apart, C. no vaccine needed if born after 1970, and D. only varicella dose. Correct answer is B. Question number 27. For an adult who works in healthcare and lacks record of varicella immunity, the recommendation is A. no action needed, B. one dose varicella vaccine, C. two doses varicella vaccine, and D. serological testing only. Correct answer is C. Question number 28. New immigrant with undocumented immunization record should be treated as A. fully immunized, B. deferred immunization until retesting, C. given only one dose of each vaccine, D. unimmunized and started on an age-appropriate schedule. Correct answer is D. Question number 29. Which of these is not a guideline for administration of immunizing agents? A. Administer vaccine within expiry date. B. Use cold chain monitoring for storage and transport. C. Administer any vaccine regardless of current illness with fever. And D. Follow manufacturer's product monograph for handling. Correct answer is C. Question number 30. Which adult population group is specifically recommended to receive pneumococcal conjugate vaccine, pneumoC20? A. All adults at age 30. B. Adults 65 or older, adults at high risk of invasive pneumococcal disease. C. Only children, and D. only travelers. Correct answer is B. Question number 31. What is the minimum interval between first and second dose of MMR? A. 2 weeks, B. 3 weeks, C 4 weeks, and D 8 weeks. Correct answer is C. Question number 32. Which vaccine protects against Haemophilus influenza type B? A. DTaP, B. IPV, C. MMR, and D. HAPE conjugate vaccine. Correct answer is D. Question number 33. For a child aged 24 to 60 months of age with no risk factors and never immunized for pneumococcus, how many doses of pneumo C15 or 20 are needed? A. 0, B. 1, C. 2, and D. 3. Correct answer is B. Question number 34. The recommended site for IM vaccine for an adult is A. Gluteal muscle, B. Vastus lateralis, C. Deltoid muscle, and D. Abdomen. Correct answer is C. Question number 35. A child received the first dose of varicella vaccine at 12 months of age. The second dose may be given as early as A. 13 months, B. 16 months, minimum interval 3 months, C. 24 months, and D. 48 months. Correct answer is B. Question number 36. What does 9V HPV refer to? A. 9-valent human papillomavirus vaccine, B. 9 doses required for HPV, C. A HPV test, and D. A booster for HPV only given in adulthood. Correct answer is A. Question number 37. For an infant 6 months old with no previous influenza vaccination, the first influenza season vaccine requires A. No vaccine this season, B. 1 dose only, C. 2 doses at least 4 weeks apart, and D. 2 doses at least 8 weeks apart. Correct answer is C. Question number 38. A nurse is preparing to give an IM vaccine. The correct needle insertion angle is A. 30 degree, B. 45 degree, C. 60 degree, and D. 90 degree. Correct answer is D. Question number 39. Which vaccine is recommended for pregnant persons depending on risk and gestation? A. Varicella, B. HPV, C. Tdap, and D. Smallpox. Correct answer is C. Question number 40. Regarding measles immunity in adults born before 1970, A. They can be assumed immune and require no MMR. B. They must receive 2 doses MMR anyway. C. They are exempt from all immunizations. And D. They must have a booster every 10 years. The correct answer is A. And that's all for today. Thank you very much. Uh, Thank you very much for joining me. And you can go to my second video for immunization part 2.